All right. Hello, everyone. We are so excited to have you with us here today. My name is Chelsea Tibbetts, and I am the Perinatal Programs Coordinator at the Wisconsin Women's Health Foundation. I am here with Dr. Stephanie Slock, and we are very excited for today's webinar, which we have titled Lactation and Alcohol Use. What do our My Baby and Me participants need to know? This webinar will explore the commonly misunderstood topic of alcohol use and lactation. And our guest speaker, Dr. Stephanie Slock, she's a pediatrician and certified lactation consultant with Aurora Health Care. She's going to be exploring matters such as the pharmacology behind alcohol in breast milk, the potential risks associated for mom and baby, and how to best educate parents on this issue. I do want to share a little bit more about Dr. Stephanie Slock, as she is truly a remarkable person, and all that she has done, we are very thankful that she is spending her morning with us. So Dr. Stephanie Slock is a pediatrician and breastfeeding medicine specialist with Aurora Health Care Medical Group in West Allis, Wisconsin. She earned her bachelor's in science from UW Madison and her medical degree from the Medical College of Wisconsin, completing her pediatric training at Children's Hospital of Wisconsin in Milwaukee. She is board certified in pediatrics and is also an international board certified lactation consultant as of 2009. She is an active member of the American Academy of Pediatrics and the Academy of Breastfeeding Medicine, and currently serves on the executive committee for the Wisconsin Breastfeeding Coalition. She enjoys golfing, being outdoors, and reading. While she has spent many years as a pediatrician giving families guidance and support in raising their children, she is also excited to have a family of her own, and she loves spending time with her husband and their 4-year-old son. So I'd like to introduce at this time Dr. Stephanie Slock, and thank you so much for being here with us today.
All right, thank you for having me. That was a wonderful introduction. I'm so excited to be here with you today. I certainly understand that this is kind of a unexplored or unknown topic, and so it took me a little bit of time to kind of put this talk together and really bring together what I think is the most important information as far as background with alcohol use, alcohol in breastfeeding, a little bit about alcohol in pregnancy, and as a pediatrician and lactation consultant, how I counsel my families and maybe be able to give you some tips on what you can do when you're educating the women that you take care of. I don't know if this whole talk will last an hour. I will do my best not to go too fast or too slow, but we will have time at the end for some questions. So if there are things I don't cover that you would like me to go over, we'll have time. So I have no disclosures to make as part of this discussion. I really thought it would be pertinent to kind of talk about alcohol in history a little bit. It was really interesting when I started doing some of my research, looking back, and I think it really highlights the importance of why we're talking about alcohol in breastfeeding right now. How prevalent is the alcohol use? How long has it been around? Why do we need to know this as opposed to just saying, well, don't consume any alcohol. It's not that big of a deal. So looking back in all of the information that I could find, the use of alcohol for so many different reasons has been documented in prehistoric times, back in ancient Egypt, Babylonian times. I mean, if you start doing research on the history of alcohol, it's pretty much been around for as long as we can find documentation in history. The reasons they used it are quite variable. And again, I don't have all the information listed here, but I have a couple of fun facts. But, you know, whether they thought they were using it for nutritional purposes versus some medicinal purposes, for more recreational purposes, it is all variable. But here's a couple of interesting things that I found during my research. So, did you know that the Puritans brought more beer than water on the Mayflower when they departed for the New World? And here specifically 42 tons of beer and 10 gallons of wine, and then contrasting that to really only 14 tons of water. So if I remember correctly, part of the reason they landed was they were about to run out of beer. which is very interesting. But again, researching that, it sounds like they thought that beer was more nutritional than water. So they thought all of the grains and the stuff that was used in the fermentation process offered a lot of nutrition, which is why they had more beer than water with them. In 2013, there were over 2,000 craft breweries in the United States. Their production has become so popular that they constitute 30% of Costco's beer sales. Kind of found that very interesting. If California were a nation, it would be the 4th leading wine producing country in the world, only behind France, Italy, and Spain, which I imagine all of those countries / the state of California seem roughly the same size, but I think it's very interesting that California would be 4th leading. And then, of course, our beloved state, Wisconsin. Wisconsin's current alcohol use remains the highest, sometimes second highest, depending on the year you look at, in the nation with regards to alcohol use. The rate is highest in young adult males, and I've highlighted here that I found it says, however, women of childbearing age also consume alcohol at a higher rate than other adults in the U.S. So again, this really pertains to the population of people that we take care of, childbearing age, pregnant, and breastfeeding. Beer and wine are standard beverages in many parts of the world and have been recommended to enhance lactation. So I think we've all heard that story, right? A beer a day, or many lactation consultants or nurses will suggest that a mom have a dark beer every evening, something that may help stimulate their milk supply. I will talk about this in a little bit more detail with regards to the fact that I think it's probably a little bit more of a myth than an actual reality. But looking into it a little bit more, some of the purported reasons for using beer and wine as a galactagogue, maybe to enhance relaxation, right? Mothers relax, they feel a little bit better, maybe it'll help with their letdown. Certainly at one point was thought to be an appetite stimulant and or to help with a little bit of nutrition in the postpartum breastfeeding mother. And then many different studies that I looked at, it was variable whether it was the yeast, the hops, or the barley, but any one of those were reported to increase prolactin production. And so the thought that was if you were consuming, one of these on a regular basis, again, maybe a beer a day, that you could help increase your prolactin secretion, which would ultimately help with your milk production. And I will, again, talk about this a little bit later, but that's sort of the theory behind why some people say a beer a day is good for your milk supply. The other interesting fact, though, when you look back into history, the beer used for lactation purposes was a little bit different. It was more nutritionally rich, and it was actually lower in alcohol. So when they did their in-home brewing, the process of mashing, which was the boiling of the malt and grains and herbs put together to make the beer, was actually performed twice. And these beers or alcoholic beverages were lower in alcohol and thought to be more nutritionally rich. So again, between a little bit more of an appetite stimulant, some nutrition, maybe some relaxation, these were all thought to be very helpful in the breastfeeding mother. Again, just as a little bit of background going into this, I found a very interesting study about alcohol use in pregnancy. I know that many of you counsel mothers during the prenatal and postnatal period. So I just thought it was very interesting looking back that over the course of the last, 20 years, in 1991, and this was a study done with women in the United States. At that time, about 12.5% of pregnant women were consuming alcohol. And this was roughly like a beer a day or a couple drinks a week. It was not considered binge drinking. So the study did outline the number of alcoholic beverages that were consumed. It went down from 1991 to 2002. So in 10 years, we went down from 12% to 10%. But then in only 3 years, went back up to 12%. And again, you can see the range when they studied was somewhere between 10 and 16% of women were consuming alcohol while pregnant. The thought being that this might actually be a little bit lower and not totally correct, because I think we realize some women are probably not going to be 100% truthful for fear of judgment or knowing that maybe they're not supposed to be drinking alcohol while pregnant. So we're not entirely sure. These numbers may be a little bit higher. And incidentally, in 2005, 2% of pregnant women, admitted to binge drinking. So this was more than 4 or 5 drinks in one sitting. So it's there, right? We know that pregnant women are drinking. We know that women who are breastfeeding are drinking. We know that alcohol has been around for centuries and centuries. And so our job as providers, people that take care of these women, is to educate them on the best they can do to keep their babies safe and still be able to partake in a little bit of alcohol consumption. Interestingly enough, we think we drink a lot here in the United States. Looking at these figures here, the 12, 10, and 12%, these are actually very low compared to some other countries who, if you're thinking more like Eastern European or European countries where they tend to consume a little bit more beer or alcohol, our numbers are a little bit lower. The difficulty in coming up with sort of hard and fast rules with alcohol intake in lactation is it's a little bit different than pregnancy, right? I think we have more information about alcohol use in pregnancy, the potential negative effects, and alcohol is maybe a teratogen, just because we've had more time to study it. There was a time when, we didn't know that alcohol was going to have negative side effects on a developing fetus. And so, looking back and looking at studies, there's definitely a correlation. We know that if you consume, more than X amount of alcoholic drinks a day, that you could potentially be putting your child at risk for, and if you look down below under the known side effects, growth retardation, premature or preterm delivery, potential craniofacial dysmorphisms, neurological and behavioral problems. So these children later in life were found to have more problems with potentially things like ADD or ADHD, difficulty with other types of learning disabilities. And again, in parentheses there, I have FAS for fetal alcohol syndrome. And if you look up fetal alcohol syndrome, it really is a set of defined criteria, some facial characteristics, some facial dysmorphisms, and some neurological and behavioral abnormalities that when put together in combination with a known exposure to alcohol while in the womb, we get fetal alcohol syndrome. So, and the other thing that I think about when we're talking about medications, alcohol, tobacco, drugs, anything that you are exposing your body to do while you are either pregnant or lactating, it's a little bit different in pregnancy because the baby is constantly exposed, right, during pregnancy. So alcohol and its toxic metabolite, which is acetaldehyde, can cross the placenta into the fetal bloodstream and also get into the amniotic fluid. So many of the things, whether it's nutrients, toxins, waste, all of that generally will cross the placenta, get into the bloodstream, and the baby will be exposed to that. If those toxins also get into the amniotic fluid, you have to remember that amniotic fluid is recirculated. Not only are they bathed in it, but they swallow it. And, so if you have this constant exposure to a potential teratogen like alcohol or its toxic metabolites, there's no way to get rid of that. It really doesn't come back out. You have this constant exposure. Whereas in a breastfeeding dyad mom baby, it's a little bit different because we can time it differently, right? It's an intermittent exposure because the baby is not getting breast milk 24 hours a day, 7 days a week, 365 days a year. Although I feel like many new moms feel that way because babies are at the breast all the time. But again, it's just kind of a different scenario. And again, we just don't have a lot of studies as far as pregnancy and lactation. So again, just to sort of reiterate that we know that alcohol is a known teratogen. The placenta is the lifeline of the developing fetus, so it's the barrier through which everything passes, and the baby is constantly exposed to whatever potential medication, nutrients, toxins that the pregnant mother is exposing her body to. As far as lactation goes, again, it is more of an intermittent exposure, and I think we just don't have as much information. I mean, I think of the lack of studies, and specifically with relation to alcohol. I mean, I think there are some different studies when it comes to using medications while breastfeeding. I think most of us are aware of like Thomas Hale's medications in mother's milk, or using LactMed online, or different forums for looking up the safety of a medication while breastfeeding. But alcohol is not a medication. Tobacco is not a medication. Drugs are not a medication. So I think, when you're looking these things up, there isn't quite as much evidence, because you can't really talk about the risks and benefits of being on something like alcohol or tobacco while breastfeeding, right? There is technically no benefit to mother, whereas it's easier to say, oh, well, this mother has high blood pressure. She needs to be on some type of antihypertensive. Let's work with her to find the one that is less likely to get into the breast milk or less likely to affect the baby. When we talk about things like postpartum depression, or, any number of things that need to be treated for the safety of the mother, there's a really important factor there. Mother needs a medication. We figure out the right medication that can be safely used while breastfeeding. We know that. Again, I think when it comes to things like, and Chelsea and I were talking earlier about mothers that smoke, tobacco use, and alcohol. If you were to ask most healthcare providers, the answer would be simple, right? Don't do it. There's no benefit to you. Think about your baby. So I think this is a little bit of a difficult topic. And also when it comes to the ethics of doing studies, there really aren't a lot of studies. I found a handful of them when I was preparing for this talk, but not a lot that say, hey, how many of you are, willing to enroll in this study where you consume X amount of alcohol and then breastfeed your baby, and let's see what potential side effects might show up. And even long term, like, is this going to create any problems with learning disabilities, or what is a chronic exposure? None of that can really ethically be done. So some of it has to be sort of extrapolated based on what we know from alcohol in pregnancy, fetal alcohol syndrome, the effects of alcohol on an adult in sort of a long-term chronic exposure situation, and we just have to make our best guesses. So with that being said, I'm going to go over a little bit of the kind of the boring stuff, the chemistry, the pharmacokinetics and pharmacodynamics of alcohol, kind of explain what that means, and talk about how alcohol gets into the breast milk, which is going to help us figure out how we are going to educate our mothers. So pharmacokinetics essentially is how the organism affects the drug. So how our body acts on a drug. How do we absorb it? How do we metabolize it? Where does it go? How is it distributed throughout the body? How is it eliminated? All the stuff that we do to affect the drug. And when we look at this sort of stuff, if you're talking about chemistry, the things that really are important in the pharmacokinetics of a drug, and again, I'm talking about alcohol as if it's a medication or a drug in this instance, is the molecular weight, so how big of a molecule it is. It's protein binding, so is it free floating in the serum / bloodstream, or is it highly protein bound? Is it soluble in water? Is it soluble in fat? So where is it going to distribute in the body based on its solubility, which kind of also goes into the ionization, or something called pKa. So at what pH is a molecule either neutral or ionized, which helps us figure out what organs it might end up in, if it will stay in the bloodstream, if it will get trapped somewhere based on ionization. Bioavailability, always a really interesting one to me. So bioavailability is how available is this substance to your body when it's ingested. So, or the route with which it needs to be ingested. So medications that are orally bioavailable are given orally because they are best absorbed through either the stomach or the GI tract. Certainly there are medications that are not orally bioavailable. So, when we talk about things like insulin, right? Insulin is given via injection because it is not orally bioavailable. If you take it orally, your gastric juices and acids will digest it and it will not work. So, that being said, if I give myself insulin and I'm breastfeeding, my insulin, even if insulin could get to the baby's taking the milk orally, right? So anything that is not orally bioavailable even if it gets into mother's bloodstream, probably is not going to affect an infant. So that's very interesting. And again, there's a lot of stuff that goes into this. Thinking about the mechanism of transport. And this is, I think, really important when you're talking about breastfeeding. How does a molecule get into the breast milk? How does it get transported from the bloodstream to the breast milk? And that will be important to know the concentration of that drug, medication, toxin, whatever, in the breast milk. So let's look at alcohol. Here is ethanol. This is the form, molecular structure of the alcohol that is in what we think of as alcohol. Our recreationally consumed things like beer, wine, spirits, that sort of thing. So as far as molecules go, turns out alcohol is a fairly small molecule. I wrote down its molecular weight, 46 grams per mole. I don't know that that means anything to anybody. I will be honest, I don't know like what's considered large and small. I want to say, if I remember way back to my college days, things like, I want to say over 150 or 200 are considered large. But again, when you think about smaller molecules, they are more likely to pass through membranes. I think they can navigate their way through different barriers or membranes in the body a little bit easier, right? Or they may be taken up through different transporters easier. If you have a giant molecule, it's not just going to easily slip through a membrane. So again, sometimes when we are looking at drugs that are safe in breastfeeding, if it is a super large molecule, it's not going to be found in very high concentrations in the breast milk because it just can't traverse those membranes, that barrier between the bloodstream, the cellular wall, and into the breast milk. Protein binding. So again, molecules can float around free in the bloodstream, or they can be highly protein bound. The more protein bound something is, the less likely it will be available to, say, pass through a membrane or be sort of an active available molecule. So if it's highly protein bound, again, less likely to get into the breast milk, maybe less likely to be an issue. Turns out alcohol not very protein bound. So there's two things for us. It's small and it's not very highly protein bound. Turns out alcohol is soluble in both water and lipids. So this means it can kind of go anywhere in the body, right? Our bodies are made up mostly of water, but the lipid portion is like the cell membrane, right? Or crossing into the central nervous system. So we know that alcohol affects the central nervous system. It affects your judgment. Turns out it is a little bit more water soluble than it is lipid soluble, but either way, this makes it fairly, bioavailable again, or able to sort of diffuse its way through the entire body. Again, alcohol is orally bioavailable, although interestingly enough, I do believe alcohol can be absorbed from many other areas of the body. It doesn't only have to be taken orally. Obviously, I imagine it could be injected, and I've heard of very weird things like people using alcohol enemas. It's possible, but when we are talking about the availability to a baby, I think, and we talked about this on the last slide, the importance for me is that it is orally bioavailable. So if a baby were to get alcohol through the breast milk, it would be available for their body to metabolize and potentially, turn into its toxic metabolites. So it is not an ionized molecule, so it tends not to get trapped inside cells or in areas. So again, is a fairly neutral molecule. It moves around very easily. And its mechanism of transport, and I think this was on the last slide. Let me go back one. That top, I don't know, will you see it if I do this? Yeah. So this top picture here shows you different ways that molecules go through a cell membrane. So assuming that this white area at the top is the bloodstream, and that these cells here are the cells they have to get through to get inside the milk in the cells inside the breast. Alcohol goes by passive diffusion, which means it really just passes through based on a gradient. The more that is over here, so the more that's in your bloodstream, the more that's going to start to pass through the cell because it wants to equalize its concentrations, right? It wants to equilibrate between those two fluids. So it is not taken through different transporters. Again, sometimes things that are transported in then don't really get transported out and can get trapped. Some things have to have special transporters, and so like if there wasn't a transporter for alcohol, maybe it wouldn't get through the membrane. But essentially it turns out it kind of gets through in the easiest way, just by simple diffusion based on a gradient. So let's go up here. So we talked about a couple of different things as far as absorption. And again, this really, when I was putting this together, I think makes a little bit more sense when we're talking about medications, when you're talking about the route of ingestion, and when we talked about bioavailability. So are you taking something orally? Are you injecting it? Is it subcutaneous injections? Is it intramuscular? Is it IV? Is it something, that can be absorbed through the mucosal? Is it like an intranasal steroid, nasal spray? Is there enemas? Again, all of that is important when you're thinking about how molecules are absorbed and ingested and how much your body is going to absorb. The other thing to be aware of, and again, when we're talking about alcohol, is the dosage form. And I'll kind of go into this a little bit later when people ask you, like, is one better than the other? Not necessarily, but just know that their alcohol concentrations are different, right? So beer is anywhere, and somehow that didn't come out right. It's a 7 to 8%. It's supposed to be like 4 to 8%. Most beers are probably 4.5 to 5. Some of them can reach on the top level 7 to 8%. Wine, roughly 12%, give or take, and then most liquors are in the 40% range, although obviously there are some that are a little bit more concentrated and some that are a little bit less. And then have to think about gastric emptying, right? Once something gets into the stomach, how fast does it pass through into the intestines and then start getting eliminated? So some of the things that will affect how you absorb alcohol and how you eliminate it, maybe when did you eat last? Do you have a full stomach? How hydrated are you? Body distribution. So we talked about water content, and we know that alcohol is very highly water soluble, and that water makes up a great percentage of our body. But think about other things that are going to affect the distribution of a medication or a molecule, right? How big you are, how much body fat you have, what your percentage of body water is based on how large a person you are, whether you are male or female, the younger you are, the older you are. All of this stuff will affect your metabolism and your ability to absorb and then distribute some type of molecule. Also blood flow. Where is the blood flowing to? Where is this going to take the molecule? So there's a lot of different things to think about as far as the size of the molecule, how orally bioavailable it is, the type of person that is ingesting this. So again, a large male versus a small female. All of this really has to be taken into account for when you're thinking about what's going to end up in breast milk or how this might affect a baby. I think something that everybody always wants to know is how is alcohol eliminated from the body and how long does it take, right? So the big question is, if I have one drink, my baby just breastfed, I'm going to have a glass of wine, how long do I have to wait until it is officially eliminated from the body? And this is really going to vary per person. I have had some people tell me they use, if you have one drink, 1 hour, 2 drinks, 2 hours. And I'll show you a little nomogram here that it's going to be based on your size, again, your weight, your tolerance, whether you are male or female. Clearly we're talking about females in this instant. But I think to be on the safe side, I would say it takes about 2 hours per drink to really eliminate most of the alcohol from your system. And when I say drink, obviously this could be different for anybody and everybody. I mean, you go to a bar and you could get the little pint, or you could get their extra large, tall, I don't even know how many ounces that is, 24 ounces or something of beer. That's actually 2 drinks. So when we're talking about a drink, we're looking at roughly 12 grams of alcohol. So for a 12-ounce beer, or for that 12 grams, it would be a 12-ounce beer at 4.5%. It would be 4 ounces of wine at 12%, or 1 ounce of any liquor that is roughly 40%, which would be 100 proof. So again, the number, when you're thinking about one drink, that equals 12 grams of actual alcohol. But really, when you're talking about the percentage of alcohol in the type of drink you're drinking, it is going to be a little bit variable. So, if somebody drinks a 12-ounce glass of wine, that's going to be a little bit different than if they had 4 ounces of wine. And I did want to show you this nomogram that I found. So it went, I was kind of Googling this, and I found this fantastic nomogram on this website called Mother Risk. Okay, and I think you all should be able to see that, right? So what it does, we're looking on the left column at mother's weight. They have it in both kilograms and pounds. And then on the top, the rows or the columns on the top tell you how many drinks. And then once you go down, it will tell you how many hours it will take to eliminate that drink. So again, if you are looking at, let's see, column 1 here. So this is one drink, and I go down from, a 90-pound woman all the way to a 180-pound woman, it's roughly 2 to 3 hours, right? Once you get into somebody that's a little bit larger, it's actually going to metabolize a little bit faster. So you get about an hour and a half. Interestingly enough, if you start drinking back-to-back drinks, it actually takes longer for the alcohol. So if you have 2 drinks very quickly in a row, some people might think, okay, well, that just takes 2 hours, right? I just had a drink. Again, the volume of your drink will actually affect how long it takes that alcohol to be eliminated from your body. So once you have the equivalent of 2 drinks, it essentially doubles. Most of these in the second row are going from about 3 to 3.5 hours to about 5 hours. So again, depending on the alcohol content of your drink, I feel like I usually tell people 2 hours per drink based on this type of nomogram. Sometimes I'll say, like if you used to drink a lot and you have a pretty decent tolerance, you might be able to get away with 2 drinks and just wait 3 hours. But again, this can show you the variability based on the size of a person. But then see, once we've gone out to 3 or 4 drinks, really you're getting past what is going to be safe to be breastfeeding in the next 2 to 3 hours. And so, we're going to have to educate moms on how they may plan for that. Because again, if you just rapidly drink 3 shots or 4 shots, you can't expect that your alcohol elimination is going to stay in that 2 to 3 hour window. So I think that's something important to know. And again, I was just looking this up online. There are several other nomograms that look very similar to this. So if it's something you would like to use in your office just as a demonstrator for your families, I think that would be great. Okay. And then I think we also talked a little bit about just that last line there, that food, weight, and timing all affect your absorption and elimination of pretty much anything, but again, in this instance, alcohol. So what does this mean? So putting this all together, putting aside the crazy chemistry and all the tables and everything, the gist of it is alcohol passes freely back and forth between blood and breast milk. So there's nothing holding it back. Essentially, whatever is in the blood is going to get to the breast milk, which then gets to the baby. In general, I think we've all probably heard this rule of thumb for medications. Most things, the baby gets about 1 to 2% of whatever is, in mother's blood or plasma. I guess I don't know how to say it. I use 1 or 2% a lot when I think about things getting into breast milk, but I do think it's always important to look back at LactMed and look at medications in mother's milk and make sure that you're not assuming that everything is 1%, because there really are a handful of medications that might actually get concentrated in the milk and could be higher, and some things that could be lower. But again, for this purposes, looking at alcohol, it really was about 1 to 3% of whatever mother's blood alcohol level was, which doesn't sound like a lot. I mean, if she had 1 or 2 drinks and fed the baby, 1% of that, which then needs to be metabolized through the baby system, not a lot, probably not going to have any effect on the baby. But a couple things to remember. Babies have an immature liver until somewhere around 3 months of life. So your liver is where you are going to metabolize a lot of this stuff. So I think, again, the younger the baby is, you might be a little bit more cautious about exposing your infant to alcohol through breast milk. Okay, so now let's talk about the pharmacodynamics. So we have pharmacokinetics, which is how the organism affects the drug. Now we have pharmacodynamics, which is how the drug affects the organism. So this is what we think about, like, how does alcohol affect us when we drink it? I labeled them into two categories, positive versus negative. I will say, once I get done talking, more of these are going to be negative than positive. But the purported positives are increased mood, right? You feel better, you're more relaxed, and maybe this little bit of bump in milk supply, which I'm going to debunk in a minute. Negative effects. So there are studies that have shown that mothers who are under the influence of alcohol have decreased milk ejection, so a little bit of a decreased letdown, and decreased milk transfer for a number of reasons. And I'll get into that when we talk about the effects on the baby. Some of the thoughts are that the milk will be flavored slightly differently based on mother's alcohol consumption, that maybe the babies don't particularly like it, or just because the alcohol starts to affect the baby and affects their latch and their ability to transfer milk. So you have decreased milk ejection, decreased milk transfer, both of which can potentially lower your milk supply over the long term. And then the big one for me I have on here is just impaired judgment, and that would really depend on how much alcohol you're consuming. And then just as a sort of background on pharmacodynamics and alcohol, this is just a little table of like how much alcohol, like what your blood alcohol content would be, and what its associated feelings would be. So, you know, at like 0.02 to 0.03, which is maybe 1 to 2 drinks for the average person, this is when you're going to be relaxed, you're going to feel a little bit better. Once we start, you know, going beyond 2 drinks, so let's say 2 to 4, and your blood alcohol content goes up, you're still relaxed, but you're, you know, warm, you're maybe a little bit flushed. We notice that your reaction time is not as good, your muscle coordination maybe isn't the best. And again, as we go down the line, more drinks end up with, you know, a little bit too relaxed, not being able to react timely to an urgent situation, losing muscle coordination, say when you're holding your baby. And then you start getting down to, after about 5, 6, 7 drinks, really gross impairment of a lot of different things. So I do have, again, I can't get the link to work on here, but I did put on there the link to what I used. And again, it's the same type of nomogram, like your weight, the number of drinks, and what your potential blood alcohol level will be. Looking at this now, I realize it does not distinguish between men and women. I think this is just kind of an average. And certainly there are many other things that go into this, right? It's like whether you have a high alcohol tolerance because you are chronically exposed, whether you just ate something, whether you haven't eaten anything in 12 hours. But again, I just wanted to show you the link that I used when putting that in this slide. Okay, so what about the effects on the infant? So, oh, this might be good, right? Babies can get a little bit sleepy. So if I have 1 or 2 drinks and then after an hour, maybe I decide to feed my baby, ooh, the baby's going to be sleepy. I guess I could take that. That would be good, right? Well, is that sleepiness good? What happens when the baby sleeps too long? That might affect your milk supply negatively if the baby misses a feeding. What about what happens when they wake up? So the studies have shown that although initially the babies are sleepy, shortly thereafter they actually become agitated and sleep less. So they seem to be a little bit more irritable. And again, there's this decreased milk transfer. So the thought is, you know, is it because initially they were sleepy, maybe at like the 2-hour, 3-hour mark, they got a little bit of alcohol, they're a little bit sleepy, they're not suckling as efficiently, maybe they're not staying at the breast as long, maybe they don't like the milk flavor, and then all of a sudden you think, well, the baby's sleepy, whatever, we'll make up for it at the next feeding. Well, now the baby is like agitated and up more often, say at night or in the upcoming hours than, you know, you really had anticipated. So again, there can be some negative effects on the infant. Oh, and I'll go back just for a second. This is really the immediate sort of short-term effects on infants that have been exposed to mother's milk that had some alcohol in it. I don't have any evidence for, again, long-term exposure, like women that say regularly had a glass of wine every night and then breastfed their baby, and 3 years later, what is the cognitive function of that baby? That's the stuff that I was talking about earlier. Ethically and historically, we just don't have that information. So sometimes it's hard to come up with the right things to tell families when it really isn't evidence-based. So, common myths. I'm going to dispel a couple common myths for you. So my first one is really abstinence is not reality. And I think we all know that, right? In many settings, whether you're talking to teenagers about abstaining from sex, whether you are talking about not co-sleeping. So again, in the lactation world and as a pediatrician, I feel like this is something that comes up all the time. People that are co-sleeping or bed sharing. And I find that telling people not to do it isn't always the right answer, because you do have this gut feeling, right, that people are just going to nod and smile and go home and do it anyway. So I feel like you really have to educate people about the safe way to do things. So if you're not going to abstain from sex, please be smart. If you're going to co-sleep or bed share, please do it in a way that puts your baby in the safest possible scenario, you and your baby. And again, kind of the same thing about alcohol in pregnancy and breastfeeding. Like, I don't think saying don't do it is the answer. I think really informing our patients and telling them how to be smart about it is the way to go. I also think this concept of a beer a day will help your milk supply is really kind of bogus. And I did there's a study on my reference page that I read through. And it's kind of an interesting study. It was done in 2010, and it looked at the relationship between breastfeeding and prolactin levels in lactating women who had a family history of alcoholism. Now, the women did not have problems with alcoholism. It was a family history. And it compared them to some controls. And really, essentially, the gist of the study is they found that alcohol did not enhance lactation performance at all. And it demonstrated that although there was a slight bump in an increase in prolactin, overall, the alcohol consumption interfered with both milk production and milk ejection. So that little bit of increase in prolactin really didn't seem to correlate clinically with what we were seeing. And interestingly, the studies that were done prior to this, they had actually done studies in men and non-lactating women. So, I don't know how you can extrapolate that to a lactating woman, right? They had done these studies that said, sure, after you had consumed a couple of drinks, your prolactin levels went up. Great. I could see how you could say, okay, if your prolactin level goes up, it's going to help you make more milk. But again, these were studies done in a population that really doesn't transfer over. So finally, looking at lactating women, we did say, yep, prolactin did go up a little bit, but turns out their milk supply didn't have any benefit from that. And in fact, it did decrease their milk ejection reflex. And there was some discussion about the babies not feeding as well. Again, whether that was to be attributed to milk flavor or sleepiness or agitation. Again, I feel like the gist of it is I just don't recommend that, especially for women that don't like beer. I would not tell them not to, but I just don't think it's going to help their milk supply. Another myth, pumping and dumping eliminates alcohol from the milk. And I think probably all of us know this already, but when you're talking to families, I think this is something important to know. I had a mom tell me once, well, I heard that the more I pump and dump, the faster the alcohol gets eliminated and I can feed my baby sooner. Yep, no, that's not the way it works. So that whole metabolism takes 2 hours thing, you're not affecting your body's metabolism, or you're not pulling alcohol from the bloodstream into the milk and then pulling the milk out and sort of eliminating anything faster. The reason that we suggest pumping and dumping is so that mother can relieve engorgement and so she can keep up her milk supply. So we don't want, if you're going to drink and skip a feeding, I don't want you to sit with engorged breasts and then have that signal sent to your brain that says, oh, maybe we're not feeding as much anymore, let's stop producing. So I try to explain to my families how the reason we do it is for your comfort and to keep your milk supply going so that when you are done drinking, there's still milk there for the baby. My other little thing here, I just wanted to make a little bit of mention of breast milk alcohol test strips. I don't know if any of you have any experience with these, use them, don't use them. I don't. I tried to look up some studies on this, and again, this is one of those things, there just really aren't any good studies. I don't know who is out there drinking milk, providing, or drinking alcohol, providing breast milk, and then, testing all these different types of test strips. But I want to give you a little blurb that I found on a website, which for me personally confirms the reason why you don't use them. So this says, this is a mom on a forum where some woman had asked, like, do you use these? Do they work? And, I'd really like to have a drink. I don't know what to do. And this woman says, they work. Make sure you have a milk backup. All I had was a glass of wine and it put me in the no feed zone. I'm going to test in 2 hours and hope it's fine. Everyone will test different, but it works. So I don't know, did that work? She had one glass of wine and then she couldn't feed her baby. My question is, did you use the test strip immediately after you drank your wine? You're going to test in 2 more hours and it'll be fine. My thought with the breast milk test strips is you're really not relying on how you feel. You're not using your common sense or clinical judgment. You may end up not feeding your baby when you probably could. What if you had one glass of wine, 3 hours later you want to breastfeed, you use one of these test strips and it turns positive? Now you feel guilty, now you're forced to pump and potentially dump. What if you don't have a backup supply for your baby and you end up giving formula and you feel terrible? I mean, this is the reason why I feel like they probably don't work. I'm sure they can detect metabolites of alcohol in breast milk. I just think it's probably not, it doesn't tell you whether it's safe to provide that milk or not. And again, I think the information I'm going to give you going forward makes more sense. These breast milk test strips are expensive, and I think it's just going to make moms feel worse, honestly. So I'm going to go through my quick summary. I'm going to tell you what I tell my patients, and then we'll take some questions. So timing and amount are key. Anything in moderation. I know we've heard that about all sorts of things in life. But one of the interesting things I heard while I was looking up information for this talk is that if you can drive, you can breastfeed. So if you're going to have 1 drink, 2 drinks, and like 2 hours later you feel fine and you would definitely get into a vehicle and drive and feel safe that you were not above the legal limit, you can easily breastfeed your baby. And that means something different to everybody, but again, that's what I heard. Try not to stress about it. Try not to put parents in a stressful situation. I don't want anybody giving up on breastfeeding because we made this super stressful for them. It's not about that. Overall, I wouldn't suggest milk test strips because they don't really work, at least not the way we want them to. And I think being an informed consumer is always key. So again, like we talked about with the abstinence rule, like it's better to provide people with a safe way to do something than telling them not to do it at all. So alcohol diffuses into breast milk passively. So generally your blood alcohol level will equal your milk alcohol level. Blood alcohol peaks at about 15 to 30 minutes. After about 30 to 60 minutes, your milk alcohol level will equal that. So again, if you're going to have something to drink, probably feed the baby, have your drink. You're going to peak around 30 to 45, maybe 60 minutes. Wait another hour. You'll be low enough that you can breastfeed your baby. Know that it'll concentrate over time or with the increase in number of drinks in a short period of time, right? So the more drinks you have, you may actually get a little bit more concentration, not just in breast milk, but like in your body essentially, that will make it take longer to eliminate. It can affect your milk supply negatively. It can also affect judgment. So I'll talk about that a little bit later. And remember that in large amounts, it can affect your infant, either causing sleepiness, agitation, and less effective breastfeeding. So what do I tell families? What if I have a mom that says, can I drink alcohol? Yes, I don't think that you should ever tell somebody no, but I think you should get a background to it and you should answer the questions that they have, being mindful of the situation. If you have a mother that says, geez, I really love wine and I used to have a glass of wine every night or every other night, can I still do that? Absolutely. Let's talk about timing of it and just know how to be safe. And maybe it's important to have backup milk just in case you decide to have an extra glass or 2. But sometimes I ask too, what are you going to be doing? Are you going out to Summerfest or State Fair or a wedding, or you're going to be gone for a long time and potentially having a lot to drink, because that's a different scenario. Yes, you can still do it, but there are other things we need to think about, like who's caring for the baby, backup milk supply, do you have a pump to pump and dump and a place to pump and dump? So again, it's not always about, and again, the situation, it's not always about the breastfeeding. Sometimes it's about the baby. And the reason I bring this up is, like, yes, you can drink alcohol, but what makes me a little bit nervous when I talk to families is, you know, if you're a single mother and you're at home and your 2-month-old normally sleeps through the night every night, right? And this night you decide you're going to have a couple of drinks and you're going to say, to heck with it, the baby doesn't ever wake up. And so I got 8 hours or 10 hours to process this alcohol. I'm going to have 4 or 5 drinks. What if that night your infant wakes up and needs you for something, has a fever, cries in the middle of the night, needs consoling? How impaired are you going to be? Are you going to be able to take care of that baby? Are you going to be stumbling around trying to take care of an infant? Will you have backup milk to feed them? Will they be in a safe situation? So again, it's always good to be mindful of, you know, what the plans of the parents are. So I talk to my moms a lot about, like, knowing how much they can drink, how often they can drink, when and where they're going to be, knowing their tolerance level. So again, will the baby be with you, or will they be at grandma's and you're going to have some drinks and you're just going to have to pump and dump to maintain your supply? And it is what it is. If you still feel pretty crummy in the morning and you're really hungover, there's probably enough of that toxic metabolite in your body still that I would continue to pump and dump in the morning until you feel relatively okay. And maybe not 100%, but relatively okay. And if you're ever concerned, you know, always use a backup. Never hurts. Is one type of drink better than another? No, and we talked about this. So, you know, the volume is going to be different. 6 ounces of beer has less alcohol than 6 ounces of wine, which is less than 6 ounces of hard liquor, right? So pick your poison, but just know how it affects you and know what your limit is. I think this is also important. I hear a lot of, you know, beer can help your milk supply, but it has to be dark beer. Oh, you have to. I had one mom 2 weeks ago that said she started drinking a Guinness a night. And I said, oh, I do not like Guinness. How's that going for you? And she said, I don't know. I've acquired a taste for it. It wasn't great at first. And I thought, why would you put yourself through that just to help increase your milk supply? And is it really even going to work? Like, for me, I guess I personally would rather talk about using some fenugreek and some extra pumping and some hydration. And yeah, you can still have a beer night if you want, but pick the one you really like, or have a glass of wine. Like, I don't think it really matters. How long do you have to wait to breastfeed? A lot of parents will ask you that. Again, we have that nomogram that I provided you. You can use the, hey, if you think you can drive, you can still breastfeed. Or, you know, if you're just not sure, pump and potentially dump, depending on the scenario. And if parents ask about pumping and dumping, again, remind them it doesn't eliminate alcohol any faster, but we're doing this to maintain supply and comfort. Okay, so that being said, again, my difficulty preparing this talk was that things are just not cut and dry. You can't, like, every woman is not the same. Their alcohol tolerance is not the same. Their size, their body weight, and, you know, water percent, everything is different, right? So I don't think one rule works well for everybody. And I think you kind of got to go case by case. But if you're looking for an absolute number, or you have a mom that is really a stickler for, like, I want, just tell me what I can do. I would say if you've had 2 drinks or less, and it's been over 2 hours, you can breastfeed your baby. I don't think I would worry about a nomogram or calculating anything out. At that point, the level in the milk is going to be so low that by the time it gets to the baby and gets metabolized, there's going to be probably almost undetectable amounts in an infant. And I don't think it's going to affect milk supply or ejection, maybe milk flavoring. But again, as far as like milk ejection and letdown, if you had 1 or 2 drinks and 3 hours later you fed your baby, you're fine. I don't know that I would do that all day long, you know, feed the baby, wait till they go to sleep, drink again. Because again, remember, that adds up over time. You should avoid breastfeeding your baby if you have been drinking and the following apply. You've had more than 2 drinks, or you could not safely drive a car. Like if you thought you were over the legal limit. And then my next recommendation would be if you're planning on drinking more than 3 drinks, here are some recommendations for safely feeding your baby. Make sure you have previously pumped breast milk or formula if that's your choice. During that time, you're going to have to pump and dump your milk to keep your milk supply going and relieve engorgement. And if you are at all worried about level of impairment, make sure you plan for a sitter or caretaker. Because again, we're talking about just babies being exposed to breast milk, but remember that also means babies exposed to potentially an intoxicated mother. So I always think about that as a pediatrician and a mom. So there are my references. Hopefully this all made sense. Answered a lot of the questions that you ladies might have. I know I kind of ran almost to the end of time, but I'd love to hear any questions you might have for me.
Absolutely. Thank you so much. As a soon-to-be mother myself and someone who loves to have a glass of wine or a good beer here and there, I also have learned a lot. So what I would love to do now is we did have some questions come in. There was a question asking what is BAL and MAL. So if you just wanted to kind of confirm that. And then anyone else who has questions, please continue to write them in.
How do I get back to the first couple?
No problem.
Okay. So I realized that, and actually go back to the beginning, I realized that I did not address that real well right there, forward 2. So under gastric emptying, I did do BAL peak and MAL peak. So sorry, I should have clarified, that's blood alcohol level. So it will peak here in about 15 to 30 minutes. And then milk alcohol level, which eventually will parallel, because remember that passive diffusion, they will equal each other probably in the 30 to 60 minute range.
What is the prevalence of FAS?
That is a good question. I don't know off the top of my head. And I would say the difficulty with that, I certainly could look it up and probably give you a number. Although I've had this come up in my practice. I've taken care of foster children whose foster parents were concerned that the child had fetal alcohol syndrome. And the problem with it is it's a very difficult diagnosis because it's very subjective, right? You have to look at the child. They have to have certain facial characteristics, a very thin upper lip, a flat philtrum, wide set eyes. They have to have some sort of cognitive/learning disability, a neurodevelopmental something. And so I think, and a history of known alcohol exposure. So sometimes we just don't know. If you have a foster child, you have no idea how much alcohol the parent consumed. You don't know if the child looks different because that's the way their parent looked. I think that, again, I could look it up and give you a number, but my guess is that fetal alcohol syndrome is probably higher than the numbers that we have because there are a lot of undiagnosed children out there with fetal alcohol syndrome. I'd like to think that the more we know about alcohol, the levels are going down. I mean, I imagine we saw more of it in the 70s and 80s when we didn't realize how bad alcohol was during pregnancy, and that going forward we don't see as much of it, but there certainly are still women that binge drink while they're pregnant. So.
And I would say too, this is Chelsea talking, with the My Baby Me programming that we have, we could provide you with some more information on prevalence of FAS as well. So if that's something that you're interested in, please let us know. So thank you.
Yeah.
Another question came in. Do you think that they're educating moms appropriately in breastfeeding classes on how to safely go about drinking postpartum, or is it just not being discussed? I worry they're just told not to drink and then don't have the information they need.
That's a really good question. And because I do not run any of the breastfeeding classes, I don't know for sure. But my gut would tell me they probably breeze over it a little bit. I know some of the lactation consultants at West Allis Memorial Hospital where I work and have privileges, and I would bet they kind of touch on it briefly. But I do think, as far as I think pediatricians don't address it, I don't think OBGYNs address it. I think the thought is either that people are just not going to drink or that they sort of have the, quote, common sense to know, to only have one and time it out correctly. So I do feel like I've encountered a lot of mothers that come in and they kind of look at me a little sheepishly and say, I kind of have this silly question, like I hope this isn't dumb, and they're almost ashamed, but I think nobody went over this with them. And as a pediatrician and a lactation consultant, I want my moms to be as informed as possible, and I certainly wouldn't want them, to give up breastfeeding because they thought they couldn't have their glass of wine while breastfeed, or just be miserable because they were like, nope, can't touch alcohol for the next 12 months because I plan on breastfeeding for 12 months. Nope, not going to do it. Then you might be missing social events. You might not just be relaxing as much as you need to. It doesn't have to be that stressful. So, I don't think it's probably touched on enough, but I can't say with any certainty, just because I haven't attended those classes.
Well, I can say, this is Chelsea again, as someone who recently did attend the classes, and I'll just be honest, I did not disclose my career or knowledge in this area prior to, but it did get brought up. And I would say that when it was brought up, there was an extreme amount of interest from the women in the room. Mm-hmm. There was a lot of questions, or a lot of follow-up questions from people who had been relatively quiet the entire rest of the class.
Right.
And the direction that the facilitator took was very nonchalant. Oh, if you're having a few, don't worry about it. If you're having more, then you're probably going to just need to think about it a little bit more. So it was a very blanket statement. I think she may have said to encourage moms to go back to their OBGYNs or pediatricians, but I will say that that was not a topic that I feel like she was comfortable addressing, which is not an uncommon thing that we see.
Right. And I feel like there are other pediatricians out there too that kind of make that same statement, right? Like, sure, it's fine to have one drink. And then they just end it there and like walk out of the room. And it's like, I don't think you really answered the question that patient had. Like, I'm sure everybody knows, not everybody, but like maybe one drink is okay. Like, I think these women are really trying to figure out information. Give me guidance. What is too much? When do I need to pump and dump? Is this going to affect my baby? And if so, how?
Absolutely. We had a couple more questions come in, so I think we'll answer those. And then from there, if you have other questions, please connect with us and we'll get them to Dr. Slock. So with these two questions left, and then we'll finish up. This question mentions, it was mentioned more than once during this presentation that a mother's alcohol tolerance is a factor in determining how much a fetus or baby will be affected, implying if her tolerance is high, then the baby won't receive as much alcohol. However, the blood alcohol content is not affected by tolerance, and to apply your "if you feel safe to drive, you may breastfeed" guidelines, those with high tolerance will feel they can drive despite their high blood alcohol content. So a little bit more of a comment than a question.
No, and I agree with that. You're right. And I think part of my discussion of tolerance was, I guess I didn't address that as appropriately, and you made a great point, would be the mother knowing her limits or not knowing her limits, right? So if you have a very high tolerance and you feel like you're fine to drive at 5 beers, maybe you're not going to talk to that mom about using that, like, if you can drive, you can breastfeed. Or again, sometimes when I interview my mothers and say, and it's kind of a personal thing, I don't know that moms want to admit to being binge drinkers, but like, did you routinely consume alcohol before you were pregnant? If you did, your tolerance might be different and alcohol might affect you differently. And so maybe I would err on that side of 1 to 2 drinks. And if you're going to go over that, know that that's going to affect the baby, even if you feel okay. So you're right. I didn't quite clear that up, but thank you for mentioning that.
Yeah, I think it's certainly a factor to consider, and I'm actually really glad that you brought it up, Dr. Slock. But I think in those cases, like you were saying, it's important to know your moms, and in that case, it may be more beneficial to stick with some of the quote-unquote hard numbers, like the 2 hours per drink would be safe versus going about it from the standpoint of the driving, kind of taking that into consideration. So, yeah.
Right. And I think part of the thing I was getting at, too, and maybe looking at some of those nomograms, a larger person, their blood alcohol content is going to be a little bit lower with the same number of drinks than a smaller person. I know that has nothing to do with tolerance, but there are just so many things that go into it. And so, again, it's hard to make these exact numbers that are going to fit every single person. So if you're not comfortable because you don't know this person really well, I would say stick with those numbers.
Yeah, and I think it was wonderful to have you go through the pharmacokinetics as well as the pharmacology, and just reiterated that although this is not a cut and dry topic, there are a lot of factors to go through. There are some things that we can kind of say with more certainty. So yeah, absolutely. And then couple things. Last question here is, it's good to hear the common sense answers for moms that breastfeed and would like to have a drink sometimes. Thank you. So I think that was just kind of that last piece that you reviewed. Yes. So thank you so much to everyone who tuned in with us today. If you know someone who was unable to tune in with us today, we do have this available. We did record it, so it will be made available through our monthly e-newsletter. So you can expect that yet this month. I guess it is the 2nd of August. So we encourage you to share that to anyone who was unable to tune in. And I just again want to say thank you so very much to Dr. Slock. I know I learned a lot. In general, I think it was a great way to just approach the topic, and I appreciate you talking about the history of this, and also just knowing that we can't always approach this from an abstinence, if you're going to breastfeed, you can't drink, and being able to do so in a safe way that doesn't put moms at risk for exposing their children unsafely, and also doesn't put mom in a position where she feels like she has to choose between one or the other. Mm-hmm. So thank you again to everyone, and enjoy the rest of your Wednesday. If you have any questions, please feel free to email those to us at the foundation. And we look forward to sharing this with you all in the future.
Thank you again for having me. This was wonderful.
Absolutely.